Hi everyone, this is Sarah McFarlane from Inside Scientific, the online environment for life science webinars, virtual events, interviews, and educational content that helps you do your best work. Our Real Science sessions focus on connecting with the researchers, educators, and industry professionals from all walks of life that make scientific discovery and innovation possible. Every year, we run a joint webinar series with the American Physiological Society, and this year's focus is on women's health, so we're excited to also be partnering with the Society for Women's Health Research. Our next guest on our podcast today is Dr. Stella Goulopoulou, Associate Professor at the Lawrence Longo Center for Perinatal Biology at Loma Linda University. She's an upcoming speaker in our series who's here to share about her research and why she's passionate about women's health. Stella, thanks so much for being here with us today.
Thank you very much, Sarah, for the invitation. I'm very excited for our talk today.
Great. Okay, so I'd just like to start by asking if you can give us a really quick summary of your research.
So in my lab, we studied the cardiovascular system during pregnancy. So the cardiovascular system, in other words, the heart and the vessels, change during pregnancy, but we don't really understand how these changes happen. So in my lab, we studied the how. What biological adjustments at the molecular and cellular level must happen in the maternal vessels during pregnancy, and when the proper adjustments in the vascular system of the mother support the growth of the baby, because the maternal vessels can provide enough oxygen and nutrients that the baby needs to grow, but also healthy vessels support a healthy mother. We studied these physiological responses during healthy pregnancies, but also in pregnancies with preeclampsia. In preeclampsia, the mother has high blood pressure and her vessels do not work properly, and often the placenta is damaged or does not grow as it should. So my research team and our collaborators work together to find out how the damage of the placenta affects the maternal cardiovascular system and causes preeclampsia, which is actually one of the leading causes of death among mothers.
Okay, wow. Thank you for that. I'm going to move on to the next question. How did you become interested in women's health research, and what motivates you to continue in this field?
So we know that historically female biology, I am a vascular biologist, a vascular physiologist, so a female biology has been ignored, neglected, and understudied. So as a result, we do not really know how the body organs of a woman work. Lack of knowledge leads to bias and bad decisions that affect people's lives for a very long time. So there is gender bias in diagnosis and medical treatments currently, and lack of treatments for diseases that are very unique to women, such as uterine fibroids, endometriosis, menopause, and so forth. So I have dedicated my research program and my voice as a scientist and as a citizen to improving women's health research and policies related to women's health. So my motivation is that today, women and girls around the world, and even more so women and girls who have been historically marginalized, do not have a fair opportunity to achieve their highest level of health and a good quality of life. So I think as a biomedical community, with or without intention, we have failed half of the world's population and we need to do better. And this is what really motivates me.
Amazing. Yeah, I agree. I think you're totally right. There has been a large population of people, women, that have been underserved by our healthcare system and just health research in general. So glad to be chatting with you about this because it's so important. I'm going to step away from that a little bit and talk about your personal goals. So what goals do you have related to your work, and then kind of in general the improvement of women's health in your specialty?
So just a quick reminder, my specialty is on cardiovascular physiology and cardiovascular disease as it relates specifically to pregnancy. So my goal is to contribute, to make contributions through my research to see a reduction in the gender health gap. I'm very eager to do research that informs clinical practice and public health policy reforms so we can see change on women's health. And I'm very excited to inspire and train junior scientists, the next generation, as we say, of scientists and thinkers to dedicate their own skills and talents to improving health for all. Finally, I look forward to seeing our research leading to better understanding of how conditions that are unique to, I talked earlier, but there are specific health other diseases or health conditions that are specific to women, such as pregnancy complications, endometriosis, and uterine fibroids. So I would really like our research to contribute to our understanding of how these conditions relate to cardiovascular disease and its prevalence among women.
Amazing. Love it. I think it's so important to kind of uplift the next generation, like you said, of scientists, and hopefully young girls, young women who are getting into the field will hear interviews like this and think, wow, they're rooting for me, they're trying to lift me up and get me into this space so that we can make positive change. So I think that's so important. Okay. Let's talk about some of the unique challenges that you face when conducting research specifically on preeclampsia.
So there are a lot, but let's start with maybe one of the most significant challenges in this area is inherent to the disease itself. So just to describe, preeclampsia is a multifactorial pregnancy syndrome and has variable clinical manifestations. So to put it in simple terms, not all patients follow the same course of the disease during the disease. They don't all share common risk factors, and they can present with variable symptoms and signs. So in other words, one size doesn't fit it all. And this creates difficulties, of course, for my physician colleagues, but also in research specifically, because understanding one biological process does not mean it will shed light to the entire syndrome. So it's kind of hard to, it's quite complex. On the other hand, if we come up with a predictive equation, for example, to forecast who will develop preeclampsia and who will not, it will not necessarily be successful at predicting preeclampsia or adverse outcomes for all patients. So it's this complexity of preeclampsia is very difficult to address in the laboratory, especially during basic sciences. Another challenge is that there are profound disparities in the prevalence of preeclampsia, and it seems that lived experiences, social constructs, all of these and structural constructs affect the prevalence of preeclampsia, the treatment, the management, and so forth. And they're intertwined with health disparities we see overall in medicine. So addressing these influences in basic science research, which is primarily what my laboratory does, is a very big challenge, and we need to address it if we want to generate impactful research.
Absolutely. Completely agree. I think that something like preeclampsia, which doesn't affect all pregnant people, and then not all women are pregnant all the time, and then women are only half the population, your sample size gets quite small, and then you have all of these different presentations and symptoms, and it just, your population of one type, or one almost phenotype, if you will, of presentation just starts to dwindle. So I can imagine that's really difficult. Okay, let's jump back to public health a little bit. So in your opinion, how can public health policies better support research and initiatives that aim to improve women's health outcomes?
I would like to start with a positive example of how we have current changes in policy that could lead hopefully to changes actually in practice and application. So we do know that recently President Biden signed an executive order that builds actually upon the White House initiative on women's health research, and I'm very confident that this will change the role of women's health research in the federal research portfolio, and that's very important because it can generate resources for those that they do research in women's health to take bigger strides and do more innovative projects and more projects for that matter, where they can give us more information about women's health. But we need to see this type of initiatives at different levels, not only at the federal level, of course, but at the state level, and we need to see that from nonprofit organizations that support research. Another important aspect is women's reproductive rights. They are directly related to women's health and gender health equity. So we need more work on this arena. As we know, these rights have been recently challenged, so we need to do more work on that. Another aspect is participation of women of all reproductive states to clinical trials is important, and so far, until now, there were challenges, for example, for pregnant individuals to participate in clinical trials and drug trials. So policies protecting those individuals, but also give them the opportunity to participate in clinical trials would be important. And overall, closing the women's health gap is a huge undertaking and should definitely become a priority. However, I think we need to start thinking a little bit more in more innovative ways, and we should discuss opportunities to form unique and unusual coalitions, such as research and policy experts with patients. I think we should bring patients and their families into all these conversations with respect and appreciation for their own experiences, and to acknowledge that biology is only one part of the multitude we contain as patients.
Absolutely. Totally agree. I think that by having people share their experiences as patients, it might entice more people to participate in clinical trials, to participate in this really important research and this data collection, because ultimately it just benefits everybody. So 100% agree. I think that's awesome. Okay, last question. Is there anything that you would like the public to better understand about women's health in general that is often overlooked or misunderstood?
I think I want to kind of give some information that I can put in a different perspective. What do we mean about gender health gap and what we mean about women's health research? So as I mentioned at the beginning, in my lab we study preeclampsia. So the first reference about preeclampsia, that disease that we study in the lab, can be traced back to 2,400 years ago in ancient Greece. In 2024, today, we still do not know what causes preeclampsia, and preeclampsia remains one of the leading causes of maternal deaths. So as I call it, it's a disease of 2,400 years of solitude. And this is just one example. We need to make women's health priority because women's health is everyone's health. And we need to cover all this gap we have generated throughout the years.
Love that. That's the perfect way to say it. And I know that your webinar in the series addresses a lot of this and also shares about your your in-depth research program. So super excited for that. Can't wait to hear you speak on that. I just want to thank you so much for your time and your insights today. It really was a pleasure to have you with us, and I hope you had fun.
Thank you very much, Sarah. I did have fun. Thank you.
And we hope that you enjoyed this episode of Real Science and that you'll tune into future episodes where scientists just like you answer questions about their life, their work, and share insights into what it's like to be doing real science. Don't forget to subscribe.